coming from the West, but we Indians are all doing very, very great work. And at a very minimal cost, that is more important because we need something like which is reasonable, which is accessible, and works well. So I think these devices, what you have done, especially the camera and this particular machine, I think this should be publicized in a greater way, and people should know like what exactly these means to them. So I think definitely I'll invite you to send me the topics. I'll put in the innovation session. All right. Thank you very much. Thank you
so much.
Thank you so much. And we'll go ahead with the next talk by Dr. Parul Chawla. Dr. Parul is at Chandigarh. She's in the PGI professor over there. And she's going to talk on PORBEDO, nomogram prediction of probability of rubella based on eye outcomes.
Thank you, sir, for the opportunity, and I thank Professor Maurya also. Today I'll be discussing about this nomogram that we've developed. We have named it the PORBEDO nomogram. This is the prediction of probability of rubella based on eye outcomes. So rubella is an important infectious vaccine-preventable etiology of congenital defects with disabling and life-threatening manifestations like miscarriage, congenital birth defects, and stillbirths. Rubella vaccination administered to the pregnant woman preconceptually helps almost 100% prevention of transmission from mother to the fetus. Lack of initiation of this vaccination in many developing countries makes it one of the leading causes of blindness and deafness, with an estimated incidence of 1 lakh children being born with congenital rubella syndrome, or the CRS, in a year. CRS comprises of sensorineural hearing loss, brain damage, heart malformations, and ophthalmic features like cataract, glaucoma, retinopathy, microphthalmos, and microcornea. At the level of primary and secondary healthcare centers, where larger populations are routinely catered to, it is plausible that the rubella cases could be overlooked and hence the treatment not initiated. Though evaluation of ENT signs and heart malformations requires a trained physician, and assessment of ocular signs is relatively easy, and signs like cataract, which is seen as a white reflex, microphthalmos is seen as a small eye, microcornea is seen as a small cornea, and they could be easily seen by an ASHA worker, even using a torchlight. Hence, we plan to develop a prediction nomogram based on the data acquired from multi-center surveillance sites to assess the probability of an infant being at risk for congenital rubella based on demographics and ophthalmological findings. So the aim of the study was to develop a prediction nomogram to assess the probability of an infant being at risk for congenital rubella based on demographics and ophthalmological findings. This was a cross-sectional sentinel surveillance study conducted at 5 centers spanning pan-India between November 2016 to December 2019 and involved 1,134 infants. The diagnosis of rubella was made using standard guidelines given by WHO, and for construction of the prediction model, laboratory confirmed cases were grouped as at-risk infants, and the discarded cases were not at-risk infants. What was suspected CRS? That is suspected congenital rubella syndrome. Any of the following in an infant, whether there was a structural heart defect or hearing impairment or eye signs or maternal history of rubella and a strong clinical suspicion. So this was suspected CRS. What were the clinically confirmed CRS? At least 2 clinical signs in Group A and 1 sign in Group B. What was Group A? Group A constitutes the ophthalmological signs, heart disease, and hearing impairment. And Group B is microcephaly, delay in development, splenomegaly, purpura, radiolucent bone disease, meningoencephalitis, and jaundice within 24 hours of birth. What is a clinical compatible case? Signs and symptoms of CRS, but a blood sample could not be obtained. Laboratory confirmed CRS. One of the conditions in Group A, along with detection of rubella IgM antibody or sustained detectable IgG antibody at 2 time points, 1 month apart, in the absence of a history of administration of rubella vaccine. What is congenital rubella infection? That infant has a positive rubella IgM test, but there's an absence of clinical signs from Group A. What are the discarded cases? Negative serological result for rubella, irrespective of the clinical signs. So what were the results that we obtained? The average age of the CRS infants was 3 months, and the average age of their mothers was 25 plus minus 4 years. Out of the total infants, 88% were alive and around 5% were lost to follow-up. And in our cohort, with laboratory confirmed CRS, congenital heart anomalies and eye anomalies were most commonly detected. This was the forest plot depicting the odds ratio with 95% confidence interval of the developed multivariate binomial logistic regression model. And the final model, it showed that the odds of having cataract, retinopathy, glaucoma, microcornea, and age of the infant at presentation were 3, 4.9, 2.7, 1.1 respectively for the at-risk infant as compared to the not at-risk infant. So this was the nomogram which was developed, and the bootstrapping for calibration of the model showed satisfactory results, and this nomogram along with a web version is available on shinyapps.io, Rubella Eye. And according to this prediction model, let us take an example of a 6-month-old infant with cataract and retinopathy suggestive of glaucoma infection. The cataract, according to this table which is shown, according to this nomogram which is shown, would get a score of 35. You can see that the cataract gets a score of 35 on the top line. And the retinopathy would get a score of 50. So adding it, it will become 85. And if we see on the bottommost line, that is a prediction of having rubella, the last line if you see. So that 85 corresponds to around 0.68. So the developed model had an area under the curve of 0.68, which would predict the probability of having rubella of more than 60%. That is around 68%. So this was a very important nomogram which can be kept by the ASHA workers in primary and secondary health centers, and they can just use this nomogram and just see that what is the probability of that child having rubella, and then they can send those children to the tertiary care centers. So development of web server helps in the diagnostic external validation of the model, and this will also help in the external validation of the model by pediatricians, ophthalmologists, ophthalmic assistants, and ophthalmic technicians. It could help policymakers in taking a decision. This web server could be used in the far-flung rural areas where sophisticated high-end equipment is unavailable, and to the best of our knowledge, no such nomogram has been designed till date. So to conclude, we created a prognostic and predictive nomogram with various ophthalmological clinical characteristics of a child with suspected congenital rubella. If the probability of rubella diagnosis could be quantified with ophthalmological examination, it would give more care to those infants with a higher risk, which will subsequently help in the follow-up visits also. The developed nomogram would have a community-based utilization and will help in prioritizing attention to high-risk children and thereby avoiding loss to follow-up. Thank you so much.
Thank you very much, Dr. Parul. How you are actually taking this nomogram in your practice?
So we are planning to do an external validation of this nomogram in the primary and the secondary health centers and develop a external model. So we are going to, this was done as an internal model of the 5 centers that we included. Now we will actually go into the community and see if the accredited social health workers, the ASHA workers are able to pinpoint the children with suspected rubella and refer to the tertiary care center. So we are going to externally validate this nomogram.
Okay, so they are going to the places and getting the data?
Yes, sir. If any child comes to them, they will just fill this, they will just see form, what is the probability of having, and if it is like, it has 68% validity. So if they feel that it is falling in that category, like a person who has, a child who has cataract as well as a child who has retinopathy. So the score will be higher. And if the child has 3 characteristics, cataract, retinopathy, and microcornea, so it will make it more probable of the child having rubella. So they will not need a sophisticated slit lamp there or an ophthalmologist there, just the ASHA worker can also do this.
They can do this. Okay.
Yes, sir.
That's great.
Yes, sir.
Right. Thank you very much. Thank you.